Respiratory Insufficiency by Cheyenne Muir. So, today I'm going to be talking about respiratory insufficiency. And it is, as what it sounds, it's when you're not breathing sufficient enough for survival. So, it could be a patient's just having shortness of breath that had a rapid onset. It could be your chronic asthma and COPD patients. It could be somebody choking at a restaurant, or it can be the unfortunate individual that decided it would be funny to wrap their head in saran wrap because it'd be a cool prank or joke to play, and then they couldn't get it off. So, starting out, potential causes for respiratory insufficiency can include a severe chest injury, whether it be a flail chest, a penetrating wound, an obstructed airway. They could be whether it be a gunshot wound or they fell and have rebar sticking out of their chest. You also have the possibility of carbon monoxide poisoning. Carbon monoxide is 200 to 250 times greater for the affinity to hemoglobin than oxygen has, so it's going to bind to the hemoglobin first and then not allowing the oxygen to bind it, and it causes a hypoxic state because it impairs the oxygen levels within the body, and it can cause cellular asphyxia. Anemia. So there's an abnormal red blood cell count, and depending on the patient, some tissues might be hypoxic because their blood's not carrying enough oxygen, even though the oxygen is carrying it and it's fully oxygenated. They just don't have enough because their blood cell count's lower than normal. So with that, pulse ox, it could say that their oxygen saturation is fine even though they're not. COPD, they're not able to get air in or out just because of the chronic obstruction to their airway and their pulmonary system. And overall, it's just any injury or illness that affects the process of respiration where oxygen cannot be inspired enough to meet the metabolic demands of the body. So how it works is when a patient cannot meet the oxygen demands that their body needs, it can rapidly produce shock as the organs can't survive without oxygen because we need it to survive, and the cells begin to deteriorate and dies off, and it causes organ failure. So this can still happen even if the volume of blood, their blood vessels, and the actions of the heart are all working normally. It all just depends on if they're getting the oxygen they need for their blood that gets perfusing to their body. Signs and symptoms of a patient with respiratory insufficiency: they can have an obstructed airway, choking, a foreign object, mucus, vomit, whatever it may be. They could be drowsy just because of the lack of oxygen. They could be cyanotic. Their skin could be blue, pale, ashen, depending on your type of patient. They could have shortness of breath, difficulty breathing. They can have an abnormal end tidal, whether it be high or low. And then the patient can also be hypoxic even if their SpO2 is reading high. So for your assessment and your treatment, first things first is you're going to want to treat your ABCs. If it's trauma related, CAB first. You're going to want to control and seal any hole or stabilize any impaled object in the chest that's affecting ventilations. If they have a gunshot wound to the chest, they could have a tension pneumothorax, or air can be coming in, not going out, or blood could be obstructing the lungs and the airway and the oxygenation that normally would be fine. Or it could be they have a piece of rebar impaled in their chest and it's not allowing you to bag them because of the obstruction. So you're going to want to take that out first. Next, you're going to want to clear their mouth and throat of any obstructions, such as mucus, vomitus, or foreign materials. Whether that be with a suction or a McGill forceps, you're going to want to clear that obstruction first. And if it's due to swelling, you can always intubate your patient just so you can secure that airway. Because if you don't have an airway, if you're breathing for them, it's not going to matter if the oxygen doesn't get to their lungs. Next, you're going to want to assess their SpO2, their end tidal, and their vital signs to determine the need to assist ventilations with the BVM and supplemental oxygen. If a patient is satting at 98% and is non-symptomatic, they may not need it, but if a patient is satting at 78% breathing 10 times shallowly and is having difficulty breathing, then they might need help with a BVM or supplemental oxygen. And of course, if they're not breathing at all, you're going to want to bag them and give them high flow oxygen. And last but not least, you're going to want to determine the most appropriate transport destination based on the patient's condition and local protocols. If it's a trauma patient, they may have to go to a higher level facility of care than the local urgent care